So we've got a little bit of time for questions and answers with Melanie and Kate. So, got one over there. Have we got... Where's the mic?
The mic is here.
Is that one right? Okay, excellent.
Tazra can do it.
Yes. Okay.
Thank you.
Know where we are.
Should be.
Hello. Yes.
My name is Susie Maxwell-Stewart, and Lucy over here was the second person to be diagnosed with Kabuki syndrome in the UK. When she was diagnosed, there was no speech therapists available where we lived in Essex, and therefore she didn't get speech therapy until she was 5. So I was quite interested when you said about the child development part. Because she's 31, I detect bits of her speech where she gets very lazy, whether that's the name of the game in the digital world or techie world. She doesn't read or write, so she doesn't text. It's not text speak. But I wonder if there should be intervention for even older Kabuki syndrome people too. That's all with that. It's a great question.
So I go with that one.
Yeah.
It tends, I think it's difficult as you get older, you get set in patterns. And I mentioned the 14-year-old boy I'm working with. It's very hard to change your speech once it's very ingrained. But sort of never say never. I think it's always, important to get another assessment, another opinion. But except that maybe once you've got to that age, everything is fairly ingrained. It just depends what the exact nature of that speech problem is. But an assessment would help us decide on that.
How did you get it if a lot of GPs and doctors don't be back?
Absolutely. I mean, I think your GP, if you explained that, you've got somebody in your family with unclear speech, they should access your local speech therapy service. The trouble is that would be then an adult service where they wouldn't be used to working on speech sounds and that kind of thing. So it is difficult. It would be difficult, but it's worth a try. It's worth a try.
I just want to say thank you, first of all, for both your presentations. They were very informative. Our son, he's 16 now. He's had 3 grommets, I think, before the age of 6. At the time, we were told there's a certain number of grommets that he could have put in before it starts affecting his ears. That's all the information that we got. And I just wanted to ask if you could elaborate on the effects it could have, or why there are a certain number that they could have.
Yeah, absolutely. So there's no absolute number of the amount of grommets you could have, but the thing with grommets is they are a short-term option, and usually because in an otherwise developing child without additional problems, they normally grow out of the glue ear by the time they're 8, or recurrent infections, they've developed their own immune system. So it will be unusual to need more than 1 or 2 sets of grommets. If you're needing more than 3 sets, it's suggesting this isn't a short-term problem, so then we need to look at not a short-term solution because the grommets only last 6 months. So at that stage, if a child needs more than 3 sets, we would usually say, well, should they have a longer-term grommet? Sometimes it's called a T-tube or a permavent, and they're ones that tend to stay in until you take them out. So there is no hard and fast rule that has to be 3, but it's usually, if you've needed 3, this isn't going away quickly, we need to think about something else. So I don't know if at 16 your child still has problems or not, but usually, if you said they were before 6, usually by the time they're about 8, then they have grown out of these problems.
He's still under the ENT department at our hospital. He's now wearing hearing aids, but I think at the time we were told he could only have a maximum of 3 because it could scar the eardrum.
Yeah, you can get scar. I mean, any time you have a hole in the eardrum that then heals up, which is what's going to happen with the grommet, you're putting a hole in the eardrum, you're putting the grommet in, it's healing up. You can get some kind of scar into the eardrum. It's called tympanosclerosis. It's just like a chalky patch. And that can then also then make putting more grommets in more difficult because that whole area is scarred and there isn't a lot of normal eardrum left. But without knowing what his hearing test is like now, you know, if he still has the glue ear, then a long-term grommet is an option. But then you do have the problems with that you've got a permanent hole in the eardrum, there is risk of infections with it, and if that T-tube then does come out, or you have to take it out because it's getting infected, you've got a much higher risk, 15% risk of then having a permanent hole in the eardrum. So it may be that the hearing aid is a better option for him than hearing loss.
Great question. I think we've got one. Oh, here?
And yeah, also love you to come to speak out to explain more, because we've got someone at Speak Out who went to America and was carer of someone with kabuki, and I know it's friend and to educate more people in it. But I think there should be more genetical specialists out there, not just for kabuki, but for all the rare genetical disabilities and stuff. And another question was gonna. One of my brother's girlfriend was mentioned earlier. You mentioned a lot about children, but not also what happens with adults, because they get a bit missed as well. And you mentioned like the children, but not the adults and what happens to adults with kabuki.
Yeah, and I think on that point about adults with kabuki, with Manchester Rare Condition Centre, I hope that there will be a way of kind of calling in people that got their diagnosis when they were much older or a long time ago, as things kind of we get more awareness. And that's why we do so much work with kabuki syndrome around awareness, and especially trying to involve young adults and also siblings of people who have kabuki syndrome. I think there's a question over there.
Hi, excuse me. I'm Ali from the Spanish Kabuki Association, and I have 4 questions.
Okay.
I hope they're brief.
Maybe what we'll do is take your 4 questions and then we'll get coffee.
I hope we're short. First of all, thank you for your wonderful informative presentations, Melanie. The first one is on the management for otitis media with fusion. You mentioned that the management, you can do a hearing test after 3 months. I think that's post-infection. Should there be an initial test done right after the infection, and then consider 1-3 months after?
So there's a difference between otitis media with diffusion, which is the glue ear, and acute otitis media, which is an infection. Mm-hmm. So almost certainly, if you've got an acute infection, you're going to have a hearing loss. Okay, but that should usually settle. So we wouldn't routinely do hearing tests in children because they've had an infection, because we'd expect it to resolve within a couple of months afterwards. So it's only if that hearing loss persists longer than that we recommend a hearing test, which is why I say if you think your child's got a hearing loss, give it a couple of months and then go, because actually the chances are it will get better on its own. And in times like that, that's when the otavents, let them get over the infection. Don't try and use one of those otavents when they've got an infection, then your child is never going to do it then. But if they're sort of 3-4 weeks down the line from an infection, you notice that hearing loss, doing that otavent may just help open that eustachian tube and help that fluid drain away if the hearing loss hasn't been a problem before it.
Okay, thank you. The second is, how is the sensorineural hearing loss detected? Is it something that's specifically requested, or what type of test or scan is needed to detect that?
Yeah, absolutely, good question. So sensorineural hearing loss will be picked up on a hearing test. So when you do the hearing test, you're hearing the sounds in the room, and you'll either be putting your men in a boat or looking across at something. In order to pick up whether it's sensorineural or not, you then need to play the sounds kind of directly, you need to sort of they need to hear the sounds coming in through the normal pathway, and then also wear a bone conducting device where the sound then goes directly to the inner ear. And if there is a difference between those, it'll tell you whether the sounds can't get through the conductive loss or whether it's a nerve problem. So it's all down to the hearing test, but it's the same hearing test.
Thank you. And then for the treatments for the acute otitis media, you mentioned, prophylactic treatment with antibiotics. Are antihistamine treatments also considered like Zyrtec?
There's no evidence. No evidence that it.
No.
No evidence that it will make any difference to recurrent ear infections.
Okay. Because Emilia, 4 years old, they just gave her Zyrtec because she's had 3 acute infections with.
Yeah, it might help her nasal symptoms, but it won't help. It won't help with
prevention.
No, there's no evidence from studies that have been done that it's not. It's actively put on there on the NICE guidance that it is not a treatment for glue ear or recurrent ear infections.
Got it. Oh, thank you. And my last one's for Melanie.
Okay.
Sorry. So my Amelia, she does not have cleft palate, but she does have a high arched palate.
Okay.
So I don't know if that also affects speech or pronunciation.
No, it shouldn't do. The hard palate is just there for you to push your tongue against to make sounds and your tongue against to chew food. So as long as she's got an intact hard palate, don't worry about what it looks like too much. If it's very narrow, very arched, sometimes children have to use their finger to get the food down, but it shouldn't have any sort of functional effect on her speech.
Okay, great. That's all. Thank you so much.
Thank you so much.
My email address was on there. If anybody wants to email me any questions at any point, I'm quite happy to be emailed.
And I was going to say, I will do a follow-up email to all of you at the end of today, and I'll make sure that we put the resources, those the websites that you referenced, Melanie.
I've got more I can give you as well.
Yeah, and I'll make sure that all of that goes in the email as a follow-up as well.
Some of the presentations on the email.